For those of you out there that have ever had back pain, or maybe you have back pain right now, you may have asked yourself the question, is there something more serious, more concerning as a cause for my back pain? Back pain is really common, and usually the reason for back pain is quite benign. Something has happened, but it's not really serious. However, on occasion there can be a serious reason for your back pain. And that's what I want to give you a little bit of food for thought to get thinking around not just your back pain, but any other symptoms that might be going on for you globally that may be connected, and build a bigger picture for your healthcare practitioner to figure out, actually, there is something more serious going on here that we need to investigate. Trasa here from Natural Back Health. Let's get straight into it. So some examples of potential symptoms that may indicate something is more serious is, first of all, have you had any changes in your waterworks? Any changes in your urinary patterns? Okay. Any changes in your bowel patterns? Okay. What's normal for you? That's the first thing to think about. And then, is there any changes in that? Then, has there been any changes in your pelvic floor area, your saddle area? What I mean by saddle is, if you think of a saddle when you're riding a horse, the area that saddle contacts. Is there any changes in sensation? Any feeling of numbness around that area? These are important symptoms that you may not connect with your back pain. So you might have had back pain for the last day or whatever amount of time, but you've also noticed a change in your urinary habits. You may not be connecting the two. So it's important to let a healthcare practitioner know, yeah, that's also been going on for me as well as my back pain. Other stuff that you may have had happen recently and is important in the overall picture. You could have had an infection recently. You could have had trauma if you had a sporting accident, if you had a cycling accident, if you slipped on ice, if you had a car accident. Those things, if they happened recently, they're important to bring in the picture as well. You may not have felt much at the time of the accident, but it is important to remember to mention, yes, 3 weeks ago I did have a big fall out on the football pitch. Other things are if you have pain going down both your legs. That's an important one, both legs. Also, another one is if you have a history of malignancy, a history of cancer, if you have had a recent unexplained weight loss, or both of those things. Okay, so these are things that can build a picture. Their potential, it's not always clear cut, but really what I want to get you doing is thinking about more than just your back pain. What else is going on for me? So, for example, when I'm doing a consultation with someone or just a regular checkup, if I haven't seen someone in maybe 3 or 4 months, I'll ask them, how is your general health? How are things overall? Is there any changes? Is there anything new or different going on for you? As I said, sometimes we don't think about that sporting accident that happened 4 weeks ago and maybe this new pain that we have going on in our mid-back or something. So it's about thinking globally and putting all together the pictures that may indicate a red flag and may indicate something more serious. Okay, so I hope that gets you thinking. I hope that's of help. Remember that back pain is common, and commonly the causes are pretty benign. But it's always good to have that little bit of awareness in the back of our mind, not to miss out on an important signal that our body is trying to send us. Okay, Trasa here from Natural Back Health. I hope that was of use. Tune in for more videos. I'm going to be doing a few more in the coming weeks, and thank you for listening.